My name is Dr. Romina. Thank you for attending our Wednesday Wellness webinars. This is my way of giving back to the community, sharing my knowledge, experience, and hopefully offering you some home health hacks and tips that you can use in order to reduce damages and improve your health and your livelihood and your energy. So here we go. Okay. Now, common denominator between most sports, whether you're playing baseball, basketball, soccer, football, general running, CrossFit, any kind of Peloton or any kind of exercise apps that you're running, there's a lot of lower body, upper body movements. So typically in any form of sports, the body is divided into two sections, upper body and lower body, right side and left side. And upper body balances the lower body, right side balances the left. Therefore, most of your personal trainings are going to be exercises rounded about that. The problem is, let's talk about the lower body because it tends to be used a lot more than most other sports. Generally, typical symptoms of sports injury are going to be hamstrings, IT bands or iliotibial band syndrome, right? When you get the pain on the side of your leg, and stress fractures in your ankles, shin splints, plantar fasciitis, runner's knee, which could be any problems with the patella. So today what I'm going to do for you is I'm going to basically dissect the body from bottom up so we can discuss exactly where are these injuries typically will occur and how do we prevent that for you. So here we go. Now, whether it's yourself or whether you have a loved one or a child, but before we talk about sports injury, let's talk about what you do throughout the day. So do you find yourself in any of those positions? And if you do, and if you're finding yourself to sit up straight as we're speaking, so you might want to continue listening to this webinar as it's going to be fun, it's going to be interactive, and I will give you things to do, even though I don't see you and you don't see me, but together we're going to make this happen. Different body positions when you get involved with your work is your body's adaptation to what is the next thing that you need to do. Getting involved with your work and sitting in different positions, especially if you're in e-sport. If anybody's listening to me and they're in e-sport, please continue listening because you are injuring your body by a condition called repetitive stress injuries. This leads to a lot of musculoskeletal problems. When you have weakness in your body, you're susceptible to injury. Now, for those of you who are not a desk worker, who typically be more on your smart device, whether it's an iPad, tablet, or your phone, did you know that the more you bring your head forward, the more impact is on your spine and your lower back. So throughout the day, you're about an hour or 2 or 30 minutes here and there, but multiple times throughout the day, you're on your smart device, 6 to 8 hours a day. Then you decide to go for a run on the treadmill or in your neighborhood. This is what your body is moving from this position immediately into a running position. So let's talk about your day before we talk about your hour or 2 hours of sports. You see, the important factor that you need to consider is keeping your body aligned is almost exactly like having a good foundation for your home. And an injury, let's say a car accident or sports injury, is almost equivalent to an earthquake to your body. So if there was an earthquake to your house and your foundation shifted, that would be exactly equivalent to a car accident, even if it's a fender bender. Just so you know, a small fender bender in an awkward position can cause more of an injury with a high impact in a fender bender. So let me give you an example. You're driving, you turn your head to talk to the person behind you, next to you, or you reach back with your hand, or you're putting makeup on and you get injured. Because your body is in a twisted position, you have a higher rate of injury than somebody who was just sitting normally and got hit from behind or from side. So the body position at the time of impact is very important. This relates back to sports injuries. When you're running or you're in a position and you get hit in a torqued body position, you're a lot more at effect and at effect of being injured in a higher or more demanding factor to your ligaments, tendons, and muscles. And ultimately, your joints move out of alignment. So let me talk to you about a little bit about something that's very important, and that is basic biomechanics for you. Basics biomechanic for you is when your earlobe lines up with the middle of your shoulder, that is a proper head and neck position. And I talk about this very importantly because of the fact that your head position plays a huge role in your body injury in sports. So if you're a runner and you tend to lift up your shoulders, lean your head forward, and your head is about 3 to 5 inches or 3 more inches in front of your toes, you already overloading your lower back and your hips. So let's talk about this a little bit more. This is the foundation of any sports injury. So let's talk about the first image. In chiropractic, we call this subluxation. Sub is less than, and luxation is a dislocation of a joint. So subluxation means that the joint is not dislocated, but it's not in normal position. It's somewhere in the middle, right? So when your spine or your joint, your shoulders or your hips, your pelvis, your knee or your ankles or your foot is out of alignment, it immediately ricochets and has a domino effect on the rest of your body. This would translate into abnormal effects of an abnormal pulling or tension loads on the muscles on the opposite side of shift. And sadly enough, it will affect the front muscles as well as the back muscles. So if you tend to be sitting a lot, don't be surprised that you have weak hamstrings, weak gastrocnemius muscles, weak abdominal muscles, but hyperspasm of your quadriceps, as well as your upper trapezius and levator scapula, like your upper neck and shoulder area. Ladies, if you're listening to this and you tend to cross your legs when you're sitting behind the desk, you will tend to have more of IT band problem, knee problem, and ankle and foot in the opposite direction. So please note that when one side of your pelvis is affected, the immediate impact is on the opposite side of the ankles and arches and the opposite side of your upper body. Now, consequently, problems in the spine, which is the foundation of the axle of your body, is immediately impacted by the neurological disturbances to the organs that it feeds off to. So if you are a sloucher and you have lack of endurance when you're running, or you have lack of breathing, don't be surprised because the nerves in your upper back, in between your shoulder blades, between the base of your neck and all the way to by your bra line, feed off to your heart and lung area. So you have to be cognizant of correcting your posture in order for your biomechanics to be corrected, in order for your muscles not to be affected, so you could have optimal performance in your sports. And gentlemen who tend to be sitting, or ladies who tend to be sitting, your iliopsoas muscles in your lower back, that starts from your L1, which is the last part of your ribs, attached to your hip and pelvis position. And if you're sitting with your legs crossed, if you're sitting with your wallets carried on one side more than the other, don't be surprised of having low back problems, sciatic problem, knee and arches in your feet. And don't be surprised if you get any kind of bloatiness, gas, indigestion, or a lack of sexual desire or lack of libido. These are all connected together and they're related to your lower back. So let's break it down into more of a simpler version. Your body is a kinematic chain. That's the word kinesiology comes to play. So anything causing your neck, such as forward head position, rounded shoulders if caused by keyboards, if you're losing the balance and you strengthen your core and your abdominal muscles, if you tend to bend your knee, stand more on one side compared to the other when you're standing in line at the groceries, or if you find yourself to be stronger on one leg versus the other when you're running, or you tend to be stronger with your upper body, with right side more than left side, those are all little indications that there is an imbalance between your body. And I'll discuss how to address this later on as we keep going on. But just know that your aches and pains are your smoke alarms. They're just telling you there's something wrong. Fatigue is there's something wrong. Weakness, there's something wrong. Aches, there's something wrong. So let's look at those underlying causes, right? The foundation of your biomechanics, bio means biology and mechanics means how things work. Foundation of your biomechanics is really boils down into one simple thing called your alignment. So let's do a little home screening. Now, just by looking at these pictures, which one of these do you think you are? Just pick one. Do you tend to have forward head carriage? Do you tend to have a hyperkyphosis, like an upper roundedness? Or are you mostly carrying your posture changes in your pelvis? You tend to stand more forward with your pelvis. Or are you just a forward head carriage kind of person? You have forward head syndrome. Or do you know you have scoliosis? So let's go find out. Now, we're going to do a little home exercise for you. Let me teach you how to identify your own posture problem without making an appointment. So do this screening before you pick up the phone and call us, or call your physicians or your personal trainer or your physical therapist or your chiropractor. Let's do this screening. And if you have children, please, I beg you, do this at home, because almost over 70% of scoliosis can be prevented before teens, and almost 90% can be prevented during teens. So please do this with me. All right. So go ahead and find a mirror around you. If you're working from home, just unplug your computer or your laptop and find a mirror, or even stand in front of the window. Your neighbors might think you're crazy, but so we're all the geniuses in the world, right? Okay, so here we go. I need you to march in place, move your shoulders up and down, take a deep breath in and exhale. Even if you don't have a mirror or a window or anything, just stand up and do this. Take a deep breath in, exhale, and let your shoulders relax. Fantastic. Now, draw an imaginary line between your forehead, right between your brows, nose, chin, straight down through your sternum, through your belly button, straight down to the floor. And I want you to look at yourself and look at the person in the mirror. And don't worry about your image. Just look at that person in the mirror. And look at your earlobe. Do they line up, or one tends to be higher than the other? Look at your shoulders. Are they in alignment, or one tends to be higher than the other? Look at the waistline, and look at your waistline relationship between your arms and your waistline. Do those contours look even or uneven? That's all we want to know. Do they look even or uneven? And then look at your knees. Do your kneecaps line up, or one tend to be higher than the other? One tend to be more inward compared to the other, or outward? And look at the arches of your feet or your inner ankles to see if one is falling compared to the other. This is a basic ABC of your biomechanics before you start overloading your biomechanics with sports or any kind of physical activity. Looking at you from front is a great evaluator to find out if you have a muscular or skeletal compensation. If the changes that you've noticed or the unevenness between right side versus left side is too much, just know that you may be a candidate for scoliosis, but you have to get that checked with an x-ray. Now, looking at yourself from side, make sure that your earlobe is aligned with your shoulder. Your shoulder has to be aligned with your side of your hip, the side of your hip with the outside of your knee and outside of your ankle. This is the ultimate position, also known as a plumb line. Now, if you have an uneven shoulders and you tend to have tightness in your upper back muscles, and you have reduced range of motion in your shoulder and your torso, then you definitely are a candidate that must be checked by a professional. Same thing with your hips, same thing with your knees. If you associate that unevenness with reduced range of motion and muscle tenderness, please note that you need to make an appointment with either us through telemedicine or your own chiropractor, your own physical therapist or personal trainer. All of them can help you. The problem with poor posture, it affects you and it creates a series of bad habits that affect the integrity of your bones, muscles, tendons, ligaments, soft tissue, and it will be an initiation of an early degenerative arthritis, which you don't want to go there. So let's evaluate the body from bottom up. If you do have, the simplest way to find out if you have biomechanical problems, just look at your old shoes. And look at the normal wear and tear of your shoe should be about this way. And that's based on the studies with gait analysis, running, and jogging, right? If you tend to have any of these typical wear and tears, you know that your body is already through a compensatory state. This person is almost flat foot, just so you know. This person has very high arches. Normal footprint on a wet surface should look like that. And anything other than that would be abnormal. Just so you know, these are the things that you could do at home to screen yourself, your loved ones, and your children for sure. Because if we don't do that, wear and tear can cause into plantar fasciitis, also known as the tenderness in the fascia of the bottom of your foot. It can lead to bone spurs, heel spurs up here or down there, all right, which is quite painful and you do not want to go there. Unfortunately, we tend to live with pain for a little bit before we actually it's unbearable that you seek care. So if you do have pain and you do have abnormal problems and you did these screenings and there's a problem, along with pain and aches, know that you need to make an appointment on an immediate basis, because if you don't, this will ricochet up and it will affect from bottom all the way up to the base of your skull, which may be the leading cause of your headaches. So there are different types of approaches. You could take over-the-counter medication, which most 81% of people do. You could think about surgeries, or you could basically change your poor habits. Choice is yours. We're here to help. So let's talk about the knee, because remember I told you I'm going to go from bottom up. So here we go. Let's talk about your knee. The position of your knee would determine exactly what would be the problem that you would be experiencing. If you're feeling problems in the top of your kneecap, that's really a quadricep, IT band, pelvis issue. If you have tendonitis, they go hand in hand together. That's an inflammation in the tendons. And tendons tend to be the end structure of the muscles that attach to the bone. The muscles do not directly attach to bones. They always attach via a tendon. Iliotibial band tends to have a little cuff, half cuff link kind of a style around the top of your knee. And ACL injuries tend to be inside behind your knee joint. So between the front of your knee and the back of your knee are going to be your low ACL joints pains. Now, typically there are different types of pain. You either have a neurological pain or a biomechanic pain. Biomechanic pains tend to be more related to your muscles and joints. They're deep, dull, achy in nature. And whereas neurological pain tends to have a very specific pattern, like you could literally trace it down with your fingers that you have a neurological problem. And this could be either to your legs, it could be to your arms, finger, your face, especially if you have TMJ problems, forward head syndrome, TMJ problems, and tend to shoot in between under your cheekbones or under your jaw or even around your eyes. If it's traceable, it's neurological. If it's diffused and it's achy, it's biomechanical or musculoskeletal. This is a typical pattern of a neurogenic problem. Just so you know, different levels of your lower back radiate to your legs. So you may think that you have a hip issue. You may think that you have a calf or ankle or knee problem, but it may be more of a neurological nature, which is nerve pinch. So as we go on from your feet to your knees, let's talk about your hips and the location of your pain. So your hip is not separated from your pelvis and your lumbar. They all work just like the rotator cuff muscles of the shoulder range of motion. Your hip, especially for runners, walkers, who tend to have jobs that will cause them to either stand for a prolonged period of time or sit for a prolonged period of time. Don't be surprised to have groin pain, pain inside your hip, around buttocks pain, and even lower back pain or pain along the pelvis rim. And speaking, going as we move up, I'm going to skip the spine because I'll come back to it in a whole different section, but rotator cuff is not just the muscles that surround and give you the ability to rotate your shoulder. Rotator cuff also involve your whole entire rhomboids, which attach your spine to your shoulder blade, but also they are involving your trapezius and latissimus muscle, as well as your abdominal muscles. So as well as your paraspinal or those intricate muscles that are holding each vertebra together. You cannot have one injury to a section of your body without it affecting in a more wider range of impact. So when you're working on, if you have a forward head position, you will be susceptible to cause rotator shoulder problems. So runners, please, when you're running, make sure that your biomechanic is intact. Drop your elbows, relax your shoulders, and try to maintain your eyes with the horizon. Do not look down because it will cause you to be in a forward head position that will affect your upper back and shoulder. As soon as you go to the gym to work out your upper body and your shoulders and your deltoids, your traps, your biceps, you will injure yourself. So become a smart person instead of a patient in the waiting room. And how do you do your exercises? How do you balance your exercises? You have to address the fascia as well. Just remember, divide your body into upper and lower, and horizontally, and vertically divide your body into right side and left side. Perform your exercises by counterbalancing each one. So if you're working your upper body, you definitely want to make sure you're working your lower body. If you tend to have more of, this is called the upper cross, lower cross. So look up upper cross, lower cross muscles. And I broke it down here for you. So what are the things you want to do? Upper cross means that you're slouching from your waist up. Lower cross means that your pelvis is either moving forward or backwards, right? So you tend to have either a flat back or a hyperlordosis. You tend to have a hyperkyphosis or that slouching position or forward head position. So you want to strengthen your extensor muscles, the muscles in the back, and you want to stretch the muscles in the front. And those are the muscle groups that you want to address, whether it's your deep cervical extensors, SCM pectoralis, traps, levator scapula, but to break it down and keep it simple for you, because you could actually look up every single muscle group and you don't have to have me teach you that, whereas you know better. But let me give you the foundation of what to look for, because that's more important than finding it. That's an easy find. It's finding what's important to you. And that is really based on, are you an upper cross person, are you a lower cross, or are you combined? And based on that, we can give you specific exercises that you would need to correct your body, especially if we cross-reference it with your x-rays. You reduce your rate of injuries in any kind of sports that you play. So what I did is I put together a little home kit for you. So if you tend to be an upper cross person, this is going to be an exact, perfect treatment plan that you will have. Everything you need in a box thrown in there. And this is over 26 years of biomechanical evaluation and correction of patients with x-rays and over 1.7 million patients. Yes, I am old, but I definitely love helping people. So simplifying it. And over these years, I've learned that the common denominator is simple tools that people need to prevent damages, first and foremost. Prevent the injury. Then you're going to correct it, and then you're going to stabilize it. So this would be very equivalent to if you had a leak in your plumbing. First, you want to stop the leak, and that is prevention. Second, you want to find out why the leak occurred, and that's correction. And third, you want to make sure that you check that leak on a regular basis and check your plumbing so the problem doesn't reoccur, and that is prevention. So in your home kit, if you have a forward head syndrome and you tend to have neck pain, headaches, upper back pain, shoulder problems, the home neck kit is going to give you the most 3 components of protection, prevention, and correction at home to get you started. And it works with any kind of exercise program. It works with your home office, and it works very well with your personal trainer or your chiropractic or physical therapist that you're being treated under. If you tend to have more of a full spine, you have lower back problem as well as neck and upper back issues, then you want to get a full posture home kit. In this kit, you get a series of items that not only promote the curve back into your neck, but most importantly, they hydrate the discs in your lower back, which is a group of exercises specifically for you. The ice pack, heat pack is going to relax or reduce the inflammation. The posture corrector is backed up by scientific studies that's going to help you to correct the posture, so prevent the further damages. Now, if you don't have any of those problems, but you tend to slouch in front of your computer, then maybe it's better, especially if you're working from home, so that you have been compromised in trying to find comfort between your couch, coffee table, dining table, your bed, on the floor, and you keep moving these places to find a more comfortable position to work. This is the most efficient home kit for ergonomic 101. This will put your body into proper position. So this is a fantastic way of looking at it, right? So if you need them, we're here for you. And if you don't need them, cheers to you. Let's keep moving on. Which one is better for you, ice or heat? You always want to follow ice after an acute or repetitive activity. Typically, sometimes even after a massage, because it's been stimulating your muscles and your area for a long time. So yeah, and you always want to follow rest after icing for 15 to 20 minutes. Ice creates vasoconstriction, it reduces the blood flow, therefore it reduces inflammation or swelling. Typically, we want to use ice or heat for about 20 minutes, no more than that, because they have a counter effect after that. For somebody who's having deep dull ache or who you have chronic pain, you definitely want to do heat, but heat is most effective after it's followed with stretch. That's where you get your maximum results. So just putting a pack over there and thinking it's done, it's not. So unless you're just icing it. What is the best exercise for you? If you know how to do downward dog correctly, it's one of the best exercises you can apply. When you're applying downward dog, it's not as much important the angle of your lower body to your upper body. You could have a wide angle because that's where you want to start. But it stretches your gastrocnemius by dropping your heel ever so gently to allow your muscles to relax and let go. It works if you lift your hips up, you actually can feel a good stretch in your hamstrings and your gluteus muscles. If you take a deep breath in and exhale and let your chest fall with gravity, you feel an immense amount of stretch in your trapezius, latissimus, and most importantly, lower traps that is controlling your shoulder blades. If you relax your shoulders while in downward dog, you actually would help relax the biceps and triceps. Letting your body just fall forwards and dropping your upper body weight on the heel of your hands gives you a great stretch for overactivity with your texting and with your keyboard. Securing your fingers, especially the first 4 fingers on your fingers on the ground as you're doing a downward dog, is going to allow your brachioradialis muscle, which is your forearm muscle, to relax. That's great for somebody who's on keyboard a lot. without an elbow support on their chair. So downward dog is something you can do anywhere, anytime, and specifically before and after a sports activity. So please take a moment on this and enjoy it, just like how you would enjoy a delicious meal. You take your time on the first bite, you just hold on to that and just grab that old sensation and taste on a good, delicious food. Do the same thing with your body. Let your body relax and be in that pose. That's your downward dog. Stretches are immensely effective, especially if you use a tool or a device to do that. The reason being is you'll be stretching your tendons more than you would be stretching your muscles. Make sure that you have a good workstation. So if you tend to stand, you have a sit-stand desk, please stand during the day and sit in the afternoon. This way you reduce the amount of restless leg syndrome or compensation, fatigue compensation of your hip and pelvis. So you won't find yourself shifting your body weight from one side to the other. And especially it's going to be reducing the effect of creating varicose veins. Again, if you do have poor posture problems at work, like the first one here, make sure you get your home kit. These home relief kits were specifically designed to help prevent further damages at the comfort of your own home. I hope this was effective. My name is Dr. Romina Gassemi. I come to you every Wednesday with different topics. Next week, we're going to talk about vertigo and forward head syndrome for your texters, bloggers, Instagram, influencers. And if you tend to be on your phone a lot, you definitely want to take a look at this so you won't have vertigos in your 30s, 40s, 50s, and 60s. Thank you. And I hope this was effective for you. My name is Dr. Romina, and I will see you next week. Same time, same place. Don't forget to send us a message, and we are also available for telemedicine. Have a wonderful day and happy Wednesday.